Let's build a deep squat. In this video, I'm going to take you through a few mobility drills to address each joint that's involved in the squat, being the hips, the knees, the ankles, and the spine. We're going to be actively working these joints one at a time and then putting them all together for your squat at the very end. So, like building a puzzle. When lifting an external load, we want to ideally keep the spine extended. So we'll be practicing our bodyweight squats with an extended spine at the very bottom. So let's get started first with our hip drills. Starting with a hip capsule car, we're going to work the rotation of each hip joint. Grab onto something stable, lift one leg at hip height, and press down into that leg with the hand, and the leg is going to reflexively push up back into that hand. We're slowly going to sweep the foot across the body and outside of the body into external and internal hip rotation. The thigh is going to rotate on its axis, meaning that the knee is going to stay perfectly still. The foot and shin are not initiating the movement. You want the movement to initiate from the hip. The hip stays still but rotates the thigh. It's important that as you rotate, the hip doesn't hike in either direction. So try to keep those hips nice and square, which may make the movement a little bit smaller. You may also feel your abdominals working and that standing glute. To regress this movement, you can do the same thing lying on the ground. So press the heel of the supporting leg into the floor, and now you can feel the contact with the floor with both hips. This will make it harder to compensate by shifting the hips side to side. We also have some support for the spine so that the hips won't be able to shift as much side to side or up and down. As you perform this movement, try to increase the amount of tension that you're bringing to the leg through the hand and the leg back into the hand. More tension equals deeper ranges of motion. Each rep, you're going to try to rotate that leg even further than the last rep. Let's move into another hip drill. These are called hip flexion hovers. So we're going to start in a half kneeling position with your support on the inside side, so the same side as the working leg. You're going to lift the leg and hover over a barrier and then bring your foot back down to the floor. We want to make this nice and challenging for the hip. So if you're lifting and hovering very easily over your barrier, then you want to increase the height of that barrier. If that barrier is too difficult to lift over, then you want to decrease the height of that barrier. As you're hovering, it's important to move slowly and with control so you can really feel the hip moving that leg over the barrier. We also want to keep that movement isolated. So try not to move the spine. Really drive your arm or your support down into the floor, which will help stabilize engaging your lats. And isolate at the hips as well. So just like the capsule cars, we don't want any shifting or moving of the hips as you perform this movement. It's also really common to lean away from the leg as you lift it up. Try to keep your body fully upright as you hover. These can get really intense, so make sure you're using your breath with the movement. Exhale on the lift off. Inhale as that leg is coming down. Using the breath will really help regulate the nervous system. If being on your knees is painful or difficult, or if you're having a hard time hovering over an object from your half kneeling position, then you can perform this same movement standing up. So you're going to do the same lift off and hover over your target as you would on the floor. But now, since your hips are further away from the floor, it's going to be a little bit easier to hover over that target. With the standing version, it's going to be a little bit more difficult to keep the supporting hip still as you lift and hover. Make sure that the standing foot is really gripping the floor, that standing knee is fully extended, and that the standing hip is fully extended by engaging those glutes. Try not to use momentum or fast movement in this drill. We want to really control the movement from the hip. We're moving slowly, lifting, and then hovering, almost like you're trying to separate the two movements, and always bringing that leg down nice and slowly with control. Moving on to our knee movements, we're gonna start with a knee flexion passive range hold. So you're gonna go into a quad stretch, really feeling a stretch in the front of the hip and the quads, pulling your foot as close to your hip as possible. We want the spine and the torso to remain upright. And then you're slowly gonna let go of that foot and try to maintain the bend at the knee and the extension of the hip. So try not to let the knee poke forward as you let go to hold. Try not to let the knees fall apart as you let go to hold. Cramping in the glutes and hamstrings is really common in this position. It's really challenging to keep that upper leg bone, the thigh, parallel to the standing leg as you're doing this movement. The hamstrings are in charge of bending the knee and extending the hip, and we want the hamstrings to be able to bend the knee as much as possible in our squats. Strengthening the hamstrings and training them to bend the knee in an active way can prevent knee pain in squatting motion. So we want to make sure those hamstrings are nice and strong and that the knees are used to bending. You can regress this movement by performing it lying face down on the floor, or progress the movement by doing this in a half kneeling position. It's very unlikely that as you let go of the foot, that the knee will stay as bent as it is in your stretch. But we are still trying to constantly chase that goal of closing the gap between active and passive ranges. This drill is also really good to train if you are a runner or a sprinter. Always remember to keep breathing as you're doing this drill. Especially if you're cramping, the breathing will help those tissues recognize that this position is safe to work in. Continuing with knee movement, we're now going to work on knee internal and external rotation. So you're gonna take something small like a golf ball or even a pen and set it right outside of your toes in a low kneeling position. So we're gonna work on rotation of the shin from the knee joint. So hold your knee in place by bracing one hand on either side. You're gonna drive the heel into the floor, lift the ball of the foot and the toes off the floor as you hover up and over your target. So we're working ankle dorsiflexion here in addition to that knee rotation, which is gonna be critical for your squat. So we're kind of killing two birds with one stone with this movement. As you lift and rotate, notice that when you rotate the toes inside of the knee, it's gonna be a little bit more difficult. But that's the articulation we really wanna pay attention to if we're trying to squat with the toes facing relatively forward instead of a sumo squat with the toes slightly outward. The knee needs to be able to bend and also internally rotate so that the heels don't spin inwards or the toes spin outward as you're going into your deep squat. I also like to work in this low kneeling position because the compression of the torso against the thigh also keeps that upper leg from moving and that hip from rotating. We want to keep the hip, the upper thigh, and the knee all still while we rotate and move from the shin down only. Regress this movement by simply sitting in a chair to perform the same action. Sitting in that low kneeling position can be difficult on the supporting ankle and hip and knee. So this is a viable option for many people. We can still achieve the same benefits of the rotation from the knee joint simply by just sitting in a chair. I like to hover over a solid object because you can imagine hovering over an object, but actually hovering over the physical object is going to hold your joints accountable and give you a solid point of reference over which to hover. If you're having a hard time hovering over your object, or if you get tired over time, whoops, see, like I just did there. So sometimes we can't clear the object, so we need to modify a little bit, like I just did. So you can either grab a smaller object to hover over, or you can slide that object a little bit further away from you. These hovers are really going to fatigue that anterior tibialis in front of the shin. So now moving on to ankles. As I was saying before, we want that ankle dorsiflexion to be primed and ready. So for this movement, I'm going to be doing an ankle dorsiflexion passive range hold. So from a half kneeling position, you're going to grab two objects, or you can use a wall in front of you for support. You're going to shift forward into your passive range, meaning you're going to try to pass the toes with the knee as much as possible. And then you're going to try to shift out of that position, attempting to keep the angle at the ankle or the space between the foot and the shin as small as possible. So as you shift out, I'm almost imagining that I'm initiating that movement by lifting the toes and the ball of the foot up. And then you'll reverse that movement on the way down. So you're going to try to keep the toes and the balls of the foot off of the floor for as long as possible as you shift back into your passive range. This is an intense movement, not only because we are trying to keep the angle of the passive range actively as we shift out, but also because just being in the passive range can be difficult on the knees. So to modify, you can perform just a simple ankle dorsiflexion liftoff. So from a half kneeling position, you're going to shift forward so that you don't feel that pain in the front of the knee if that's what you're experiencing. And you're just going to lift the ball of the foot and the toes off of the floor. We want this to be challenging, so you want to shift forward as far as you can without pain, and also where you can just lift an inch at most. So we're working that end range only as far as you can actively lift in your deepest position. These movements are also going to strengthen and target the anterior tibialis. So if you experience shin splints, this may be a great way to combat those. Now that we've hit the hips, knees, and ankles, we can shift to working spine, specifically T-spine extension. So from a 90-90 position, you're going to open the back leg into your bear sit. So in your bear sit position, I'll turn to the side, you're going to try to reach your knees up towards the ceiling, keep those feet flexed, and grab onto the ankles to fully extend at the spine. You're then going to try to let go and hold that position. As you let go, it's going to be very easy to let the spine round, either shifting forward or leaning away from those legs, but we want to try to keep the spine nice and long here. Progress by bringing the hands behind the head, and then finally progress to reaching the arms overhead. The reason I love this thoracic spine extension passive range hold is because the legs in the bear sit position kind of mimic a squat position. So in addition to feeling the stabilizers of the spine working here, you're also really going to feel the hips and the front of the shins working to maintain that base position as you let go to hold. If maintaining that base position is really difficult for your hips and shins, then you can regress this movement to practicing thoracic spine extension holds lying face down. So you're gonna lift the upper back and the mid back, keeping the glutes engaged and the feet pressing into the floor. Then you're gonna let go of the floor with the hands, attempt to hold that extension of the spine, and slowly bring the upper body back down. In your deep squat, we really need that thoracic extension so that we isolate the upper body from the lower body. We want the lower body squatting and the upper body stabilizing from the spine, especially if we're holding an external load. We need that spine to be able to focus on holding the load while the lower body can focus on lowering the body to the ground. Always remember to breathe when performing all of these movements. And remember that less is more. If you're feeling this movement mostly in the lower back, try to bring the chest a little bit closer to the floor so you can feel mostly the mid part of your back and between your shoulder blades holding that chest off of the floor. So now that we have all the pieces to the puzzle, let's put it together. Find your squat stance. So if the toes are facing too far out, then the knees might want to collapse in. So we might need a little more knee external rotation. If the toes are facing more in, then we're going to need a little more knee internal rotation. Your squat stance doesn't really matter as long as there's no pain involved. So we're gonna start by pulling yourself down into your squat to a target. I'm focusing on driving the knees forward over the toes as I squat and lower my hips to the target. I'm also focusing on maintaining that thoracic spine extension as I get into the position. I progress by bringing my hands behind my head. As you're squatting, keep those heels glued to the floor. So if the heels come up off of the floor, maybe change your stance a little bit or move your target up a little bit higher. If you're good with your target, then you can challenge the position even more by bringing the arms overhead or removing the target altogether and trying to squat all the way to the floor. It's helpful to think about pulling yourself down into your squat position and pushing yourself off the floor to stand, rather than letting yourself fall or lower into that squat position. I'm thinking about pulling into hip flexion, knee flexion, and ankle dorsiflexion. Keep working at this and you'll be able to relax in your deep squat and find deeper ranges of motion than you ever thought imaginable.